Hello friends, I am Dr. Narendra Rangappa. I am an orthopedic surgeon practicing orthopedic surgery since last 20 years. My field of specialty is joint replacements, arthroscopy and sports medicine. So there is a big fight going on against this debilitating disease called arthritis. So October 12th, every year we mark it as World Arthritis Day. On this occasion, we would like to educate you and bring to your notice certain conditions that may concern your life. You may have to educate yourself regarding certain facts. So I'll be talking a little bit about arthritis. Arthritis is a condition where the joint is inflamed. The word arth and itis. Arth means joint, itis means inflammation. So this arthritis can be caused by many factors. We broadly classify them into metabolic, infective and inflammatory. There is one more variety of arthritis which is called osteoarthritis or osteoarthritis. This is the most common condition that may occur in a person. Primary osteoarthritis is a condition wherein the cartilage is getting degenerated. The patient has pain in the knee, patient is not able to walk, patient is not able to sit, even the sleep is disturbed. This condition can start as early as at the age of 30 to 35 in women and around 35 to 40 in men. Primary osteoarthritis is very commonly known to occur in knee joints. Knee is a very complex joint because of which we can rotate, we can walk, we can sit, we can turn, and without properly functioning knee, it is very difficult to mobilize, sit, stand or walk. So when your knee is involved, when a young boy of 30 comes with a pain in the knee, or when a 70-year-old lady comes with a pain in the knee, so it's a matter of concern for general well-being and as well as a normal routine that we are going to lead in our life. So osteoarthritis can be diagnosed very early, as in if you come with younger patients, that is between 30 to 40 years of age. Very early stages we can diagnose them, and certain preventive measures are also there that can be advised if you are seen by us at a very early stage. In the early stage, what we usually do is to give you some medications, exercises, lifestyle altering, weight reduction, some nutraceuticals like collagen peptide, glucosamine, chondroitin sulfate are all in the market, and they are known to help to a certain extent, not though it is 100% curative, because it is a age-related process where the cartilage is getting damaged in an individual. So as you reach middle age, the problem becomes a little more exaggerated. The pain is quite constant. Night pains can occur. It disables your mobility and you have pain. So this debilitates your general life and well-being. So in these conditions, we again have some pain relieving medications, then some nutraceuticals and cartilage supplements like, again, as I mentioned, collagen peptide, chondroitin sulfate, glucosamine and plenty other molecules are present in the market. Along with this, in the very early stages, we can do what is called as a visco supplementation. The supplemented visco supplement, which contains hyaluronic acid, is known to protect the cartilage to a certain extent, prevent further damage to a certain extent, rather not to prevent it at all. So the other modality is arthroscopy. We do an arthroscopic abrasion arthroplasty where we debride the damaged or injured cartilage and we freshen up the edges, and we do what is called as a micro fracture technique to encourage regrowth of cartilage. Then at this stage, the patient is a little bit more concerned because the pain is more and activity is less because of age, because around 45 to 50 years the patient is no more young and activity is less. So most important thing at this part of the life in the middle-age crisis is a lot of exercises, keeping your weight under reduction, not putting much of stress on the joints by standing for long duration, going up and down the stairs and climbing stairs for long duration. So if you are able to protect your joint at this point of time, it prevents further damage, because the next step, when there is a further damage in the cartilage, when the pain is more severe, you will have to go and do a radical surgeries like autologous chondrocyte implantation if there is a well-demarked cartilaginous damage, or very advanced stages, we do total knee replacements. My message to you on this particular occasion of World Arthritis Day is: change your lifestyle, be active, keep your weight under check, eat healthy, and live a healthy life. Thank you.